what they refer to as thrilling murmurs, murmurs you can feel, are a big risk for mitral valve disease. And the louder the murmur, the more likely you are to already have heart enlargement in whippets. So pay attention to that, right? If your whippets are beyond breeding age and you're not doing an annual echo, that's okay. But start tracking or paying attention to intensity of heart murmur, because when they get louder and louder, it's usually a good sign that it's time to get them reevaluated. Because once they start to have heart enlargement, that's when we can make a difference with drug intervention. So there's a nice set of guidelines that were put out by cardiologists from many different places looking at mitral valve disease. And I just want to mention briefly the different stages, because I think it matters if you're treating dogs with this disease. And many whippets that have mitral valve disease will go on to a stage of disease where they require therapy. So what are the stages of mitral valve disease? Stage A is just at risk. So dogs that are at risk of getting mitral valve disease. So whippets fall into the stage A category. You could argue when you want to call a dog a stage A, whether they should be adult or senior by that time. I would say all Cavalier King Charles at all times are stage A by the time they're adults. But in general, this is no evidence of disease, but we're watching for it. Stage B, they have clear evidence of disease. And then because we're cardiologists, we couldn't keep it simple and just go on to a stage E. So we divided stage B into B1 and B2. B1 is they have mitral valve degeneration, they have a leak, you can hear it, but their heart size hasn't yet increased. And it's an important determination because when you're in stage B1, we're not yet recommending any medical intervention, really. We're not doing very much about the disease. Stage B2, the more advanced disease, is when they have mitral valve disease. It's maybe not doing much to them yet. They're not slowing down very much, but their heart size has grown. Once they reach that stage B2, that's when we're recommending that you reach for drugs, right? That's when we're starting pimobendan. That's when some of us are starting ACE inhibitors. Some people even start spironolactone late in that stage of disease. And so they might be on 1, 2, or 3 meds at stage B2 of their disease. And then stage C, that's the dreaded congestive heart failure. That's when they really get medical expansion. They go on diuretics along with their pimobendan and ACE inhibitor and spironolactone. And stage D is when we're making stuff up, right? So stage D, they're really severe. We're going beyond what we think is a normal dose. We're adding in therapies that aren't typical and doing everything we can to keep them as happy and healthy as we can for as long as possible. So these are the stages of disease. Important for you all to know, this is where we make the transition. Between B1 and B2, we go from no medical therapy to medical therapy. And so in our study, we're saying young dogs that have already gotten to stage B2 are the most severe cohort that we're interested in, right? We don't want young whippets having to be medication dependent. And so that's the thing that we're really studying the most.
What is the age?
Less than 7 or 8.
Okay, gotcha.
Yeah.
Thank you.
Yep, absolutely. So what's happening there? By the time they're reaching stage B2, they're getting this activation of their hormones that are changing what their body's doing with fluid, what their body's doing with salt, what their body's doing to their tone of their blood vessels. Those things are changing by the time you reach B2, which is why we need to intervene medically. By the time we reach stage B, their little cardiomyocytes, the heart muscle cells, are starting to leak important enzymes that we can pick up in the bloodstream. One of those is BNP. Many of you may get test results from your veterinarian that include a test called an NT-proBNP. That starts to go up when we start to see true disease. So it's stage B. And then finally, cardiac troponin I. This is what was elevated in the dogs eating the grain-free or high legume, peas, and lentil diets. Cardiac troponin I starts to go up by the time we see stage B2 as well. And those things all progressively increase as the disease gets worse. And so you saw that early view of mitral valve degeneration. This is a dog that has much more severe disease. The left atrium is really, really big. The valves are really thick and not doing very much there. Yes.
So with this data with the legumes and peas, why is this stuff still being marketed?
It's a great question. It's mostly consumer driven would be my statement. It's why you can buy 73 face creams that don't do anything for your wrinkles. I wish I knew the answer to that question. There are certain diets that should certainly have been removed from the market. You can strike that from the record on Facebook. Whoever's doing my Facebook.
So it's going back and forth. Even I think even just last year that this was no, it was debunked that it was okay to.
Yes, the people who believe that it should be debunked have absolutely put out a lot about it should be debunked. There's now been a lovely study, actually funded by the pet food industry, that ramped up the quantity of peas in a diet and showed dogs developing heart enlargement and biomarker elevation in a period of less than 3 months. They did it. The call is coming from inside the house, people. They did the study themselves. And they concluded that those dogs didn't develop DCM. And so it was fine. Because they hadn't yet hit the threshold where we would call them DCM. But their heart sizes grew and their biomarkers went up. And so, so there's a few letters into the editor about that one right now, is what I will say.
Can I also just
Yeah.
comment that for those of you who aren't watching this as closely, originally it was grain-free diets were the villain, but it turns out more often than not, it's not the fact that the grains aren't there, it's what they put in to provide protein. When you take the grain out, you have to put something else in there to provide those nutrients, and what they're putting in is legumes and peas and various things. And it seems like maybe those are more problematic. It's not that the grains are missing, is what I'm saying. So does that
Yes.
make sense to everyone? So it kind of shifted, but grain-free diets was like the thing everybody was like onto. And that wasn't the problem. It was what they did to the diet to fill in the protein gap when they took the grains out.
Yes, 100%. You cannot get around it by adding oatmeal to a bad diet, which is important to know because there are people trying that. Yes.
I have a question on the pro-BNP. Have there been any studies where you guys looked at, do whippets have a slightly higher than the 900 reference range? I know greyhounds, they said, can kind of average around 1,000 sometimes.
Yeah, I've not seen anything that shows whippets being outside the normal reference range like greyhounds can be. I have not seen that, and it certainly wasn't that way in our control dogs of our genetic study. So, great questions. Yeah.
Are there any supplements that we can do to help slow this down?
To slow down mitral valve disease. Yeah, I wish. There's a lot of things that people have tried or can try. The thing that seems to consistently have the best evidence in cardiac disease overall is omega-3 or fish oil supplementation. That can be shown to reduce cardiac arrhythmias. It can be shown to help with muscle wasting due to advanced cardiac disease. We don't have any data to show it early in a disease process. Most of what we know about it is in a later disease process. I don't think it hurts. I think fish oil is probably helpful for all of us. I take fish oil, but it certainly doesn't it isn't changing the course of this disease in major ways, at least not that we've seen. And I think like the CoQ10s and the others have not really been very exciting when looked at in that way.
So what would you recommend taking omega-3s, like how much?
Yeah, so omega-3s are really tricky because they're not regulated by the FDA in the same way. So because they're these kind of nutraceuticals, the components inside of them are very different from supplement to supplement. So I can only give you a recommendation on one that I've done the math for, which is the Nature's Made omega-3 or fish oil supplements. And I use 1,000 international units per 8 kilograms of body weight per day, based on that math. So like how much does a whippet weigh in kilograms? 20?
Yeah, 15 to 17.
So somewhere between 2 and 3 capsules a day of the 1,000 international unit nature-made fish oil capsule would be what you would aim for, but you'd want to start low and gradually increase, because if you start with 3 on day 1, they'll all have diarrhea. Yes. Yeah, great questions.
2 to 3 a day.
Yes.
Let's start low.
Yes.
Got it.
Start with 1. Yes.
Is there any correlation between taurine, and is it possible that some of the peas and legumes are blocking the absorption of
So-
taurine?
Great question. There's a lot of research around taurine and dilated cardiomyopathy in diet, and it is not consistently a feature of nutritionally mediated DCM in present day. So the pea legume thing is not constantly driving a low taurine,
Okay, thank
unless you're a golden retriever.
you. Okay, good to know.
Long story.
Got it.
So, yes.
If I go back to one of your early slides there where you were showing gene 15 is having, a
Yes.
spike y'all are looking at. Does that spike, is that all ages of dogs? And if it is, do you see a difference in that between young dogs and old dogs?
That study was stratified by disease severity, which included age as a covariate. And so that peak is kind of based on the severity of the disease, accounting for early onset versus late onset.
I was just thinking in terms of, all of us, our genetics break down as we age, and I'm just curious as to, whether that was a factor or not.
Yes, should not be. So we're looking at somatic mutations. We're looking at the genome that is not altered in these animals with this test. Yeah, good question. Yeah.
Sometimes when you're looking for a marker, you're hoping that it's just a single gene pair or recessive that you can find. Do you think that this could come down to a gene, or are we looking at 5, 6, 7, 8 different genes that all combine different ways in the same dog to produce a different manifestation of the disease?
I swear I didn't pay her for this question. It's a great question. Yes. Could be either. So the question is, could it be a single gene, or might it be multiple genes? It's a great question, and it's why this study is really important, because we are not powered in our prior work to tell you whether we're looking at just the effect of a single gene locus, or whether we're looking at gene-gene interactions or more complex patterns of inheritance. I think it's possible that it could go either way. Our study that we're working to embark on now has a sample size that will accomplish the answer to that question, which is the idea. Yes. Yes. The question was, are we looking at a disease or problem that is caused by a single gene, or might we be looking at something that is caused by multiple genetic variants all acting in concert or together? So our study that we're working on, that many of you graciously already participated in today, is to identify genetic signatures for whippets that are unlikely to progress beyond stage A or an at-risk mitral valve phenotype. I flipped this on its head, right? We could be looking for something that is causing early onset mitral valve disease, but that doesn't sound very nice. Sounds much nicer to say, let's figure out the whippets we want to maintain in the breeding pool. Let's figure out what whippets are doing well from a genetic perspective. And then we can avoid the genetic variants that are in those that get the disease earlier. How are we going to do this? We're doing this by massive whole genome sequencing. So we're looking at lots of dogs this time around, ideally. We're doing this with the help of biomarker discovery. So we're going to do proteomics. We're not just going to look at the DNA. We're also going to look at the proteins, because when we get that Manhattan plot and we get all of those signatures on those different regions, we don't know necessarily which one of those is the most important of those signatures. And we can learn a lot by seeing what's changing in the proteins that can guide us to what signature in the genetics is most important. So these are complementary strategies. They do two different things at the same time, but we're going to use them together to inform our research. And we're hoping that that will lead us to a point where we can help develop some selective breeding protocols to aim for dogs that don't get early onset or more severe mitral valve disease, right? We want you all to be surprised when your 11-year-old whippet goes into the vet and the vet says, oh, I hear a heart murmur for the first time. That's what we want, right? And so that's what the development of our breeding protocols will be aiming for at the end of the day.
Josh, can you talk a little bit about how what we might learn might help us with different ways of diagnosis, and also maybe understanding what is it that underlies the disease? So what is the pathophysiologic? Because you talked a little bit about the stuff that's forming in the little pillars and about and really I don't think we understand very much about why that happens.
That's right. So there's a lot more to learn, right? So the meat of the work is the hopeful development of genetic screening that can inform breeding protocols, right? That's what the dream is for anybody that's breeding whippets. But there's a lot more that we'll learn from this data and from this research. And an important component of that is if we identify mutations that are driving mitral valve degeneration, we're now learning about pathways or genes that are linked to this disease, like nebulette, for example, right? Let's say we learn about 6 genes that all interact and lead to an early onset mitral valve disease phenotype. And when I go in and look at those disease or those genes, they are all part of mitochondrial biogenesis. Mitochondria are kind of the power supply of the cell, and how mitochondria function is really important. Well, guess what? If I learned that about mitral valve disease, it would send me running, not walking, to the lab to tell somebody that we need to do a drug trial in dogs with mitral valve disease, because there are many drugs that restore mitochondrial biogenesis, right? But we just didn't know to grab them for mitral valve disease yet. And that could be the same story for many different findings, right? If we find a gene of interest, it might actually lead to a therapy that helps whippets and every other dog breed with mitral valve disease, right? It could be the holy grail of therapeutic intervention, right? That would be huge. We don't know that yet, right? Nebulette didn't turn out to be that because it's cytoskeletal and it doesn't really impact other breeds. But if it were a gene that you could turn on or off with a dietary supplement, it would have been massively important, right? And that's real, right? One of the Doberman mutations, actually, this is wild. I'll tell you a little story. So one of the Doberman mutations that causes dilated cardiomyopathy is in a gene known as PDK4. PDK4 is linked to cellular metabolism and energy supply at the cell. And if you feed cells in a petri dish one way versus another way, you can get rid of the effects of the mutation altogether. And so we have some really beautiful evidence of completely course correcting that disease in a petri dish based on the genes. And now there are people spending lots of their time figuring out what they can do at home in a dog that does that same thing. So very cool. That's what we need to get to for mitral valve disease. The other thing we might learn is, gosh, this gene is impacted, this protein is altered. Could we screen for this disease by measuring that protein in blood? Could we identify a biomarker that's mitral valve disease specific and tells us early on that we need to be worried about this dog more than this dog? Right? We have some cardiac biomarkers that do an okay job right now, but they're not disease specific, and we could do better. And so this research could tell us that. So the possibilities of things that we can learn go well beyond this idea of a selective breeding protocol. They go well beyond the development of a genetic test. But hopefully, the kind of holy grail is that we can wrap all of that up in one, which would be amazing. So as part of that study that we're planning, I have a call to action for those of you that are here. If you have whippets with you that have known mitral valve disease, we actually need those dogs in the study. We're doing a really good job of collecting healthy whippets that will be in our healthy cohort, right? But we need some more whippets with mitral valve disease to be enrolled, particularly if they started with their diagnosis at an early age, right? We would love to have them in our study. And there are appointments left from the Echo Clinic, and we did build in screening costs for those dogs. So we have the ability to cover the echocardiographic fees for dogs that are of great value to the study. So if you have those dogs with you and you have some free time tomorrow, particularly in the morning, stop by. Jay will hook you up. Allie can talk to you about it, and we'll get you on the calendar and get you enrolled. We'll likely be doing more of these events where we're specifically targeting certain dog populations over time as we try to fill out the study. So don't worry, it doesn't have to, be tomorrow. But if it would work out, we're here with a centrifuge and the blood tubes and the echo, and so we're ready for you. Yes, sorry.
I have one of those. You guys got her blood yesterday, so that was
Great,
actually super
thank
cool.
you.
But she was diagnosed at 4.
Yeah.
You have puppies with her that are still having their echoes. You guys also saw him and drew his blood. So when you guys are working on your study, are you looking at, like, now you have a mother with mitral valve disease and a son without it, well past the age that she was diagnosed? Do you guys track that in that study that you're relating?
Yes. So I'm very hesitant to answer this question because the grant is actually out for review, and I did not write about this in the grant. But we will likely do some additional genetic investigations, things that we call trios or small nuclear family subsets, where we can assume a pattern of inheritance and then prove it right or wrong. And those are really powerful additions to genetic studies. We don't design the study numbers around those, but we know that when we ramp a study size up to a point that it's meaningful, we're going to get those. And so we are tracking familial relationships, both genetically and with the information that we get on the dogs. And so we will do that. I'm more interested in the small families where we see it passed on clearly, that we can say, gosh, this looks like this clearly went from mother to son to grandson, for example. But all of them are very valuable. Yes.
Some of us are from Canada, and I'm just, because this study is happening in the US.
Some of us wish we were from Canada.
I wish we were living in Canada. Because this study is happening here, and I'm sure a lot of the witnesses are really, I should my name was Hollywood. But, have you thought about taking this study so that you're actually branching out and it's just not in the US, that you're actually doing North America as well? Is it?
Yeah, we have. So we haven't yet done any enrollment.
Come up if we had an international.
Yeah,
and
sure.